Who is at risk for specific types of stroke? Have you ever wondered who might be at risk for different types of strokes? Understanding the risk factors can play a crucial role in prevention and early intervention. Strokes typically fall into two main categories: ischemic strokes and hemorrhagic strokes. Each type has its own set of risk factors, but there are also some that overlap. First, let's talk about common risk factors that apply to both types of strokes. Non-modifiable factors include age, sex, family history of stroke, race, and ethnicity. These are factors we cannot change but can help identify those at higher risk. On the other hand, modifiable factors include high blood pressure, smoking, physical inactivity, obesity, and healthy cholesterol levels, diabetes, and certain medications. Addressing these can significantly lower the risk of having a stroke. Now let's dive into specific risks for ischemic strokes. Ischemic strokes happen when blood flow to the brain is blocked, often by a blood clot. Atherosclerosis, which is the narrowing of arteries due to plaque buildup, increases the risk of clot formation. Heart conditions, like atrial fibrillation and heart valve disease, also raise the risk of embolic strokes. Additionally, some younger individuals may have blood clotting disorders that predispose them to ischemic strokes. Lifestyle choices like smoking, obesity, and being sedentary further contribute to this risk. On the flip side, hemorrhagic strokes occur when there is bleeding in the brain. The most significant risk factor for this type is hypertension, as high blood pressure weakens the walls of blood vessels. Other factors include aneurysms or arteriovenous malformations, which are structural abnormalities in blood vessels that can rupture. Blood-thinning medications can increase the risk of bleeding, and trauma, especially head injuries, can lead to hemorrhagic strokes, particularly in younger people. It's important to note that while strokes are more common in older adults, younger individuals can also experience strokes due to less traditional causes. These can include trauma, blood clotting disorders, heart abnormalities, or even drug use. Each case requires careful diagnosis and tailored prevention strategies. Emerging research also highlights less common risk factors. For instance, an elevated body mass index is associated with increased stroke risk, although its role can be complex. Some stroke subtypes, like embolic stroke of undetermined source, may occur in patients with fewer traditional risk factors, indicating the need for ongoing research. Understanding your personal risk factors is essential for stroke prevention. Early recognition of stroke symptoms using the BE-FAST acronym, balance, eyes, face, arms, speech, time, can greatly improve outcomes. Making lifestyle changes, such as quitting smoking, exercising regularly, and managing your weight, can help reduce stroke risk across all types. For those with specific conditions like atrial fibrillation, tailored medical management is crucial. In summary, the risk for stroke involves a mix of fixed factors like age and genetics, along with modifiable lifestyle choices. Being aware of these factors helps guide prevention and treatment strategies. Always consult healthcare professionals for personalized advice and risk assessment.